Hello and welcome to another edition of Health Sense right here on 1FM 91.3, supported by Glen Eagles Hospital Singapore, on your side.
Now, Health Sense is a monthly series where we talk to a collective of medical and wellness specialists about a range of health matters. The theme today is in line with breast cancer awareness and osteoporosis awareness in October. Next up, we have Dr. Lo Ngai Nung, orthopedic surgeon, Glen Eagles Hospital, Singapore. Thank you for joining us, sir.
Thank you for inviting me.
Okay, according to the Straits Times, 200 million women worldwide have osteoporosis, and this figure includes 1/3 of women aged 60 to 70, 2/3 of women aged 80 or older, and 1 out of 3 women over the age of 50 will eventually have fragility fractures in their lifetime due to osteoporosis, most likely in the hip, the spine, or the wrist. So that is a scary set of figures.
It is.
Very, very scary set of figures. Is osteoporosis an old person affliction? Does it occur in young people as well? Is there anything we can do or eat to help prevent this whole process?
Okay, so this osteoporosis thing is not really a problem until you get a fracture, you see. So that's the biggest feared endpoint. So most people, so if osteoporotic, so what? They walk around town, they feel all right. And then suddenly the catastrophe happens, they fall, they fracture. I see the receiving end in the hospital as a surgeon.
Yeah.
The older lady comes in with a hip fracture. And of course, that's the disaster because they are the age where they have medical issues, and then they are facing a major surgery, and the whole family's alarmed. And they say they don't want to have surgery if possible. But that's even worse because nothing is worse than an old lady with a fracture lying in bed, and then they go downhill. So that's the scary part. So this osteoporosis thing, is it treatable? Is it preventable? And it is. The idea is to get your calcium loaded up in your younger days, such that by the time you grow old and you get, menopausal and downstream, you don't hit a low enough level that puts you at risk for fracture. And that's just that basic principle.
Yeah. But too much calcium is also not good, right?
Yeah,
because I remember like maybe 10 years, I take my multivitamins now, hopefully, with the other things that I consume, hopefully I'm getting enough calcium. But I remember someone advising me not to take calcium supplements or too much of it, because too much calcium does something bad to your system as well. What is it that is the risk factor of taking too much calcium, doctor?
Of course, in life, it's moderation in moderation. Okay. So I think you have to look at the patient's dietary requirements and her problems. Obviously, if you're calcium deficient, you have osteoporotic, then you need the supplements to keep your calcium levels up. But if you are well when you're young and you really go overboard with calcium, then of course you can run into other issues like kidney stones, too much calcium in the blood going to the urine. There's some reports that excessive calcium supplements may lead to increased heart disease because they deposit on the coronary arteries.
Any truth in that?
It's a bit controversial. I think you probably have read about it. There's always this constant thing between cardiologists and orthopedic surgeons. We're pushing for bone health, and they are like, oh, better watch it. So there is obviously a moderation, a middle path. You don't overdo it, and you do it if you need it.
The other thing is also, and I've heard this also, for bone health, you need vitamin D. So how much calcium, how much vitamin D, how do we balance that?
Yeah, so the daily dietary requirements for calcium averages around 800 to 1,000 milligrams a day. And our Asian diet, sometimes a little bit calcium deficient because we're not so into dairy products. A lot of our older patients, they have lactose intolerance, or they're not really used to milk since young, so they don't really like it. So that's why sometimes you have to supplement the Asian diet a bit. The vitamin D part, probably not so critical. We live near the equator. We got sunshine every day.
Yeah.
Only trouble is nowadays, in Singapore, you stay out the sun, you stay in the aircon room, and then the ladies put all their whitening creams and SPFs. So we may sometimes get into trouble with that. But if you were to go out into the sun 30 minutes, 3 times a day, in the late morning, you probably get enough vitamin D for your daily requirements.
30 minutes, 3 times a day.
Do you ever do that?
Okay, I'm just
Under the sun all the time.
I'm looking at my coloring. I don't think I'm doing 30 minutes 3 times a day.
Gotta play golf.
I gotta go out and play golf now.
Yeah.
Okay, Doctor, I've got a Facebook question here for you. Someone here says, I'm 35 and recently broke my elbow and had a plate placed in it. What can I do to make sure it doesn't give me problems in future?
So the thing is this, at 35, if you broke your elbow, you have to think, is this purely an accident? Did I fall from heights, or was a lot of energy involved and I broke my elbow? That's nothing to do with fragility fractures and osteoporosis. That's just bad luck, you overdid it. Whereas the fragility fractures we are talking about relating to osteoporosis are the typical story of the old granny who slipped in the bathroom and just landed on her bum.
Right.
And that's it. She's acute pain. She couldn't get up. So that's a group that you end up having to treat and screen after that for osteoporosis, and then actively manage her to prevent problems later on in life. So I think for your listener, he says, what can I be careful about? But he probably doesn't have osteoporosis. It's just bad luck, one-off event.
Right. Now, say someone's growing older and they're worried about developing osteoporosis.
Yeah.
How can they find out if they're susceptible to it? Are there supplements, medication that they can take to help them with it?
Yeah. So generally we would, the Ministry of Health has a guideline that says 65 years and above, you should perhaps go for a screening. And it just takes a simple bone density scan. It's like taking an X-ray.
Okay.
You just go down, lie down. It's like taking an X-ray, but instead of getting an X-ray film, you are getting a calculated result depending on how much X-ray got absorbed by your bone and the other side they penetrate through. So they calculate and compare with ladies of the same age, and then they see your density. So that's a very simple screen. You could do it, and if you are calculated to be in the osteoporotic range, then of course it means you're higher risk for fragility fractures, triple fall fracture, and then you should be treated. So you could go to the polyclinic, ask for one. You could see your GP, and the doctors can get you done.
Right. This is a full body X-ray that's done.
It's just a simple one-shot X-ray centered over your hip and your spine.
Oh wow!
Yeah, because these are the 2 regions that put you at most risk.
Most risk.
Hip fractures and spine fractures. So your typical grandmother who gets a little bit shorter hunch, that's actually a sign of progressive small compression fractures in the spine, you see.
Right. We all grow shorter as we grow older.
Yeah. I've been noticing that.
Yeah.
I don't know whether my kids are growing taller or I'm growing shorter. I'm not quite sure. I haven't quite figured that one out. Any tips, hints? How can we tweak our diets as Asians to help fight this osteoporosis problem?
Yeah, actually, it's not just diet. It's just 3 things you have to bear in mind. One is a diet. Yeah, so adequate calcium in your diet. So if you're calcium deficient diet, or you take supplements, or you buy fortified milks, in the supermarket, you find that there are a lot of milks that are calcium fortified,
yes.
Calcium X high cal.
Yes.
If you don't like milk, they can be soy milk, and again they're calcium fortified, or cereals,
Okay.
So that's one. Number 2 is a healthy lifestyle. So avoiding excessive smoking, alcohol, caffeine, things like that.
Caffeine?
Too much coffee.
Yeah.
And number 3 is basically exercise. You need to stimulate the bones a bit. So what we call load-bearing exercises, because you can load up all the calcium, but you're just going to lie in bed.
Yeah.
The bones are not going to get any stronger or more dense.
Right.
So you need to stimulate the bones, and the classic teaching is 30 minutes of weight-bearing exercises 5 times a week. Just go for a brisk walk. you know, or we tell the older folks, you like dancing, it's a nice exercise, Tai Chi, you know, something to stimulate the bones to load on the calcium.
But I won't
He
have
was
to work.
dancing quite a bit.
I was until
Yes.
someone mucked up my right foot. Yeah, I used to
but
dance an awful lot.
Just go for it still.
Just go
rather
for
than
it.
not do anything.
I tell you what, I'll do the brisk walk.
He used to do a dance called the ciabatta.
No, it's called the bachata.
That's
and
right.
the salsa.
That's
not
right.
I think ciabatta is a
I was thinking
bread.
of my favorite bread.
Yes, that's a bread.
Okay. I've got another question here on Facebook. You know, I have to say, our 1FM fans and their friends are just crazy about health sense, and they're
Absolutely.
taking full advantage, you know, of this segment.
Yep.
Here's another non-osteoporosis question that someone is asking, right? But they just want you to help them out here. If calcium pills are the main source of my calcium intake, is that enough? Once again, it's subjective, right?
Yes, I suppose it's a balance between dietary calcium and calcium supplements. Generally, preferred dietary calcium natural sources will be better absorbed in the body than taking calcium tablets.
Okay. And here's the confusion. There are more and more people advising us not to drink milk because it's not good for you.
Yes, this whole thing of
I love milk.
milk should stay with the cows. You know? Yeah, I love my milk too, but
I think milk's fine. I mean, especially, you know, for kids, you know,
Yeah.
you start them young, so they're treat, you know, the kids when they're growing up, you say, how am I going to get the calcium peak bone mass right up so that they never run the problems later on in life. So milk, cheese, ice cream, you know, load them up.
If we could, you got another question?
One more, yeah. I'm trying to read as many.
Yeah, you've got a lot of
my
questions coming through
Thank
today.
you so much for your questions. Now, at the age of 40, when I work out, I have lots of aches and pains. I can't reverse time now to load up on my calcium. What can I take now to sustain or maybe improve bone health? He's relating his aches and pains to the lack of calcium. How accurate is that?
So you're absolutely right. So patients often get mixed up between osteoporosis and osteoarthritis. You know, they come in the two terms easily confused. So osteoarthritis is wear and tear of your joints, age-related, activity injury related, and that causes you the aches and pains of exercise activity. Osteoporosis, unfortunately, is same thing, age related, but it's a natural sequence of our, as we age, we lose the calcium. So we don't blame everything on osteoporosis. In fact, the danger is osteoporosis is often silent until you run into the catastrophic, you know, the fracture. So that's a thing to bear in mind.
Osteoarthritis, is that when you start to get a deformation of joints?
Correct. You find these lumps and, you know,
For example, like I have here.
Well, it looks quite normal.
Yeah, but the funny thing was, my hands were in braces for almost 2 years.
Yeah.
So they thought it might be. I no longer wear the braces now, but I don't know whether that.
Yeah, they present with little deformities in the small joints in the hands. Often the commonest is in the big major weight-bearing joint, the knees. And again, since we're on women's health, more women get osteoarthritis than male. Unfortunately.
Is that right?
In an arthritic clinic, 80% of the older patients that come in, 60 and above, will be ladies rather than the guys. So.
Wow.
Doctor, what is this that you've brought with you today?
Well, it's just a little prop just to illustrate osteoporosis. So this is a section through a bone, looking at the bony architecture. And on the right, you can see a normal, nice, dense architecture pattern of what a bone should be like if it's healthy. And on the left is when it's porotic. You have the same bone, only thing is you have much less. So you have thinner seams of bone, you get more holes, more porosity. And that's the one that's prone to fracture if you have a hard knock or a bad fall.
Yeah, you can see how fragile it looks. It does look extremely fragile. So basically what we're saying is, especially when it comes to osteoporosis, you're actually starting your prevention very, very young.
Yes.
Don't leave it till later on in life.
Right.
So it's basically training your kids more than anything else.
It's basically building up that bone mass while you're still young, active, and then so that when you go into menopause, you have loaded on, and hopefully you never end up in the porotic zone as you age.
So menopause does affect the whole osteoporosis.
That's why the ladies get it more.
More.
Yes, because once they go into menopause, as they lose the drive of the estrogen, the calcium loss accelerates. So the male guys, we are in a way slightly better off.
Right.
We get porotic much older, maybe by the time we hit our 70s, 80s. But the ladies get it worse off though.
Okay. Dr. Lo, thank you so much. It's been very insightful. I know I'm not a lady, but I think I'm going to, I got to do something about my...
You were trying to get free consultation from the doctor.
Oh, you noticed it. You noticed it, did you? You did notice it. Okay, well, Dr. Lo, thank you so much for joining us.
Good times. Greatest hits. 1FM 91.3.